Those of you will be aware in the news, the big news has been that the NHS app is bringing some new stuff in it. So I thought it'd be an opportunity for today just to talk a little bit about the NHS app and my understanding of what it is and what it means for us as a practice. So just to remind you that we've got a mission statement, there for you all your life, your good health with our support, empowering you to live well. That's what we come to work for. It's not about fixing people, it's about helping people to help themselves and us supporting them in enabling that to happen. So we initially started with the Patient Access app, we then had Evergreen Life, and now we've got the NHS app. And I thought I'd just share a little bit about the NHS app itself. It's got two main purposes. The first is about improving health outcomes. Okay, now this is about supporting users, patients, to prevent, improve and manage ill health, help them and give them a feeling of control over their own health and care, and also those who they care for, increasing their skills, confidence, knowledge and capacity to self-care, and also connecting them to preventative services. Now those are all the kinds of things that we've just talked about earlier today that we're trying to grapple with, and how do we support people to do that. I often talk about patients, carers and information are the most underutilised resources the NHS has. So either we do it ourselves or we start to think about how we can support patients so that they can do some of this themselves. And the NHS app enables them to do that. The second, and this is why it's relevant to us, is it also helps to drive efficiencies and reduce the burden on us as the workforce. So the more we can help patients to help themselves, it frees us up so that we can then help those that can't help themselves. And so it helps to restore capacity at the front line, which is number one for us to be able to do what we need to do. We need to have our resources available for those who really need it, and perhaps also reduce some of the administrative type things. So it's going to increase users' ability to self-serve, for example, booking and managing appointments. It's going to help to reduce do not attends. It's going to reduce operational costs. And one of the ways it's going to do that is every time we send an SMS text message, there's a cost to that text message. We as a practice don't pay for it, but the healthcare system does. However, with the NHS app, the message is sent a bit like Wi-Fi. It's not an SMS text message, and that leads to a saving. That money can then be used for other purposes. It helps users to get to the right place first time. That's the theory that we're hoping. And we've talked a little bit about how do we stop people from not missing spirometry appointments, for instance. And one of them is sending a text message or a message to the NHS app that says, you've got an appointment at this time. And ultimately, various services that are out there for the various clinics, appointments at hospitals and other places are going to come in through the NHS app. So we really want to try and encourage as much as possible for patients to use the NHS app moving forwards. I say that because as far as I understand it, this is the NHS app. Patient Access, Evergreen Life won't do this.
What's KPI? I can't remember.
It doesn't really matter, it's a technical thing. So, the NHS app is changing and there's going to be new things coming on. And I thought I'd just give you a few of the things that the NHS app is doing now. There's things that they're going to do in the future, but these are things that they're doing now. So with regards to health records access, patients will now be able to draw graphs of their HbA1c results so that people can better see their diabetes control over time. There's more support available to help patients to understand their test results, and it also improves the format of the way blood pressure results are inputted. So when you're typing your blood pressure readings into EMIS, patients will be able to see that, and NHS app will make it easier for them to understand it. In terms of appointments, there's going to be an increased number of hospitals that allow users to view, amend, or cancel their appointment in the NHS app. And that's going to go up to 95 trusts around the country. Now, I don't know which ones in Greater Manchester are going to have that, but this is clearly just the start, and more are going to come on. So if there was a reason why someone needs an NHS app, one of them could well be so that you could view, amend, or cancel your hospital appointment. What that really means is every time you think about referring a patient to the hospital, ask them, have you got the NHS app? Have you downloaded it? How can we help you use it? Because that could save appointments at the hospital. Increase the number of hospitals that can send messages to 47 trusts and questionnaires to 40 trusts and documents to 20. So you can start to see that the kind of things that we've taken for granted in general practice, hospitals are going to start doing it, and it's going to be through the NHS app. In terms of prescriptions, they've launched the first group of users the ability to view and track the status of their prescriptions, whether they're ready for collection at the pharmacy or out for delivery. Updated screens to use the new design system and make them load faster. So again, the kind of queries about where's my prescription, is the pharmacy ready for it or not, the NHS app will start to provide information for patients so they know what's happened to their prescription. At the moment, what happens is I might say to the patient, I've done your prescription because I've hit the send button, but that doesn't necessarily mean that the pharmacy is ready to give it to the patient, and that can cause all sorts of angst. Well, this will be able to tell them that it's ready.
The message needs to change, the Actrix one, because it says
It's ready to collect.
is now ready to collect, so maybe we should just say your prescription has been sent to the chemist.
I think that's a really good suggestion, actually. Yeah.
That message almost bothered me. It's like,
Yeah, you're right. Because just because we've issued it doesn't mean it's not ready.
There is a message that tells you it depends on the pharmacy how quickly they'll get ready for you.
Right.
That one.
But what's
Okay.
the buzzwords for that one?
If you type in EPS,
Yeah.
and then it's one of the options, it comes up that your prescription's been sent to the pharmacy. The actual processing will depend on the pharmacy.
Okay.
Yeah,
But what the NHS app will do is actually tell them when the pharmacy is ready for it. So maybe we need to update that message to say, please use your NHS app, because it might tell you whether it's ready or not.
So it say that it's been dispensed. So, because like now I get a message on there to say that it's been approved and it's been signed off by the GP.
Yeah, but that doesn't mean it's ready to collect.
No, so that's going to say it's been dispensed by the pharmacy and ready for you to collect.
And that's the reason why the NHS app. Okay, so messaging, self-book and appointment reminder messages for GP surgeries using AccuRx. So at the moment, we're offering the reminder service, but you also have an opportunity for patients who could potentially book into specific clinics. We haven't activated that part of it, but it is available, and the NHS app would allow that to happen. And then finally, it provides the opportunity for other third-party services to link back into the NHS app. So for us, for instance, those of you that go to Manchester Foundation Trust, you'll be aware it's got MyMFT. And at some point, MyMFT will link with the NHS app. So you won't have to have both apps. You'll just have the NHS app, and that would link through to MyMFT without you needing to do anything. So for all these reasons, the NHS app is the way to go. And we want as many people as possible using the NHS app, because it will improve efficiencies for us. It will make them more productive so that they can do more for themselves. And also, as new functionality starts to come on board, they'll be able to benefit from it as soon as it's arrived. Okay, however, there is one thing the NHS app does not do, and that is that it does not have an onboarding consent process to provide support. So when the patients read something and they don't understand it, it doesn't tell them what to do. They're not even warned about what might happen. And remember that there's one major problem for all of us in this room. We all think it's a great idea having access to records. And of course, I've been a massive champion for it. But one day we're all going to die. One day we are going to see a blood test result, an X-ray, a scan, a letter from whoever, and it's not what we're expecting. And the problem is, at the moment, the NHS app process doesn't tell us about, doesn't warn us. Ours does. That's why the questionnaire that we do is so incredibly important, because it warns people that you might see something that might upset you. You might read a letter that's somebody else's that's not yours. You might read something that someone else has said about you, and it warns them, says, what are you going to do about it? So that's why it doesn't support this partnership of trust, because up till now, we've tended to break bad news by inviting them into the practice where we break the news. Now you go online and you suddenly find out that you've got a brain tumour, as was in a newspaper article in Liverpool that I saw just a couple of days ago, and someone that was shocked that they'd found out they'd got...
So are they not just going to put a message on NHS app saying, please be aware, you may find a letter that may not got yours, inform the surgery, you may find a letter, saying you've got,
We proactively ask the patients to do the questionnaire. They don't. That's the problem with the end. They could, yeah, that's why I'm saying it doesn't. The thing is, they could do all sorts of things. But this is the thing that they're not doing, which is why it's not it's not as safe as it could be. So So that's the NHS app. Just a reminder for everyone that alongside the NHS app, we've got the MyGM Care app. The MyGM Care app allows you individually to record your blood pressure, your weight, and your mood. It also allows you to record what's important for you, for planned care, for routine care, what you'd want the hospital to know about if you suddenly got rushed into hospital, if you're happy for your data to be used for research purposes, and if you're happy for your data to be shared. So MyGM Care, we should be recommending everyone that's got the NHS app to also get the MyGM Care app. You can also record goals on there, and as I say, important information about yourself. How do people understand how to do this all this stuff? Well, clearly the surgery is not open 24 hours a day, but the practice website is, and that's why it's not just about downloading the NHS app, it's also about ensuring that patients are signposted to the practice website, which is always open, and they can access information that can help them. Up at the top here, we've got practice services, and within practice services, we've got a whole load of different areas. So we've got anxiety care, asthma care, back pain care, contraception care, cancer care. Here's the one about cholesterol and statins and what the alternatives are, COPD care and so on. So, directing patients to the practice care website or practice services website so they can see not just general information, but specific information about how we at Haughton Thornley Medical Centres are looking after our patients, which is back to our mission statement, which is about empowering and supporting individuals to help themselves, as opposed to just leaving it to them to use ChatGPT or Google or whatever it might be. In terms of the benefits of access to records and understanding, again, just going to remind you about how important this is. This is why I've been championing it for 20 years. From a patient's point of view, they feel as though they've been listened to because they can read what you've written about them. It's safer for them, it's more effective, it's a better experience, it saves them time. They can identify errors and omissions that might be in that record. They can share information with carers or whoever they are, wherever they might be, anywhere in the world. It saves them money because they're not forgetting about things, and it helps reduce health inequalities. From our point of view, it makes our job easier because they're no longer just reading off the screen what they could have read with us. What we're reading off the screen off them. It changes that relationship so they feel as though there's a better connection between us. We can get more done, it can save us time and money, improves trust, and importantly, I think it helps to prevent burnout. And then from an organizational point of view, and the reason why I bring it here is because this is the next generation healthcare. The next generation healthcare is going to be all about using the NHS app and getting people to access their records, understand them and things. It's about modern ways of working. Do you really want to sit around for 3 weeks till the doctor calls you back? Or would you rather just go online yourself and see what you can do safely? It is about digital first. It is about responsible sharing. It increases confidence in the organization. People feel, well, you guys can't be hiding things if you're actively encouraging people to see what you're doing. Improves safety, saves money, improves the quality of the data, and increases trust. So this is our latest data from this week, and we've got 12,937 patients, and 10,563 of them, or just over 81% of them, have got the full access to the whole medical record. And you can see the graph in terms of ages from 0 to 90 plus. I think there's a bit of a gap here between 17 and 24 because every single one of them's online, but we haven't got them all signed up for online access to records. That's also the group that think they're going to live forever, but of course, if they're not eating well and they're not exercising, they're smoking, vaping, and all the rest of it, they're the ones that are going to get asthma, blood pressure, diabetes, obesity, go on to get angina, go on to have a heart attack, end up with dementia. How do we prevent that? Well, we start to get the younger people to start to become interested in their health and start to think about what else they can do. This is just another way of looking at the same data. So 87% of our patients with asthma have got access, 86% of diabetics, 97% of patients with pregnancy, 69% of patients with learning disability, and 87% with who are Bengali. So it is for everybody, but 98% of the population in the UK now has access to the internet. So there's a gap between where we are at the moment and where we need to be. At the moment, it's 81%. We really should be able to do better than that. I've mentioned consent is key, and I keep going on about this, that the questionnaire is really, really important. I don't want you thinking, just tell people to download the NHS app, because that will not give them full access to the medical records. You have to get them to do the questionnaire. It's no good sending them a link or a text message. You actually have to go through the questions with them, like our nurses are doing with the new baby checks and things. Or if they're sat in the waiting room, give them a piece of paper and say, can you please fill this form out? Ideally, tell them to fill the form out electronically, or not even on a piece of paper. But get them to do the questionnaire. It takes 2 minutes, and that unlocks everything. So in summary, currently we've got 2,374 patients who have not signed up for full access to their medical records. If we agree that 98% of the population has access to the internet, then that suggests that 2,000 of them probably should be signed up and should have the NHS app. And my big ask at the start of 2025 for us at Thornley Medical Centres is we need to go and chase after those 2,000 that haven't. We, each and every single one of us, needs to be involved in that. It can't be just left to me doing it myself. I think every encounter that they have with us, whether it's with the receptionist, whether it's with our pharmacy, PCN staff, whether it's with the HCAs, nurses, PAs, doctors, whatever they come in with, just check. Have you got the NHS app? Have you signed up for access to your records? Do you know how to use it? Okay, that's my big ask. If they're getting stuck, we'll figure out of how to deal with it. We're going to be recruiting more reception staff, and this is certainly a big drive. And for me, as we look at the pressures in terms of the NHS and all the difficulties, and by the way, Labour have talked about the fact that they want to bring the waiting time down for secondary care from 3 or 4 years down to 18 weeks, right? So there's going to be a big increase in workload at the hospital end. Now, you and I know that means there's going to be a lot more work coming our way. We have got to become a lot more efficient. We can't recruit more doctors and nurses, but what we can do is maybe get everyone who is online, making sure they're doing everything they can to try and make sure we do everything we can with the small amount of funds that we've got. So I really need everyone to be behind this. Has everyone here got the NHS app? Is there anyone here who doesn't?
I got it.
Great. So for camera, I can tell you everyone here has got it. That's great to hear. All right. So that was it. That was really about the NHS app. There's a lot of talk about how hospitals are going to suddenly start sending messages to patients to book appointments and things for various conditions, and it's going to be all beautifully done with the NHS app. I know that at the moment this isn't really being heavily promoted, so people still aren't really aware of it. But at least our patients here at Thornley Medical Centres can be encouraged to do so. Any questions about that?
Can we now encourage people to have the NHS app instead of
Well, yeah, absolutely.
access
Yep.
or
Yep.
Evergreen?
Yep, absolutely. Yeah, and even those who are happy using Patient Access or Evergreen, we actively say to them, no, please download the NHS app because of all the extra functionality that's coming. Okay, thank you.